February is Heart Health Month. Many of us have heard about how to keep a healthy heart. Eating a proper diet, lowering bad cholesterol, and having an active lifestyle are all things to help keep your heart pumping right. But what if your heart's electrical system goes haywire? This is known as atrial fibrillation, or AFib. Oftentimes, patients have no symptoms of AFib, which makes it harder yet more important to get diagnosed and treated early before AFib causes other life-threatening problems like a blood clot or stroke. According to the CDC, almost 10% of adults age 65 and over have AFib, and they estimate that as people live longer, that number is expected to rise. Dr. Vijay Divakaran, director of the Cardiac Catheterization Laboratory at Baylor Scott & White Hospital in Round Rock, Texas, sat down with us to discuss what atrial fibrillation is and how we can treat it.
So atrial fibrillation is a problem with the electrical activity of the heart. The heart has two upper chambers and two lower chambers. The upper chambers are called atria, and the heart creates an electrical impulse in the upper chamber that gets conducted to the lower chamber. In atrial fibrillation, there is disorganized electrical activity in the upper chamber of the heart, and as a result of which these upper chambers do not squeeze. It's a very common heart condition, particularly in the older population. The vast majority of patients with atrial fibrillation develop it as a result of high blood pressure. It's one of the commonest causes of atrial fibrillation. Long-standing, untreated high blood pressure can put you at risk.
Along with high blood pressure, other risk factors that are common among AFib patients are coronary heart disease, heart failure, or structural heart defects. So what are the symptoms, if any, for atrial fibrillation?
The problem with atrial fibrillation is that not everyone feels that they are in atrial fibrillation. Some patients do have symptoms of atrial fibrillation. They feel what is called palpitations, and that's the feeling that your heart is just running on its own, or some people feel fast and forceful heartbeats or irregular heartbeats.
Like Dr. Divakaran said, some people feel no symptoms, but here are some other top ones to look out for. Shortness of breath, weakness, chest pain, and fatigue are some of the more common warning signs. If you experience any of these symptoms, it's important to seek treatment early. By doing so, it will help lower your risk for any potential complications like stroke. Dr. Divakaran says that there are two main treatments to help get your heart back on a healthy rhythm.
So there are two strategies for managing atrial fibrillation. Other than taking care of the risk of stroke with a blood thinner, if you look at the rhythm itself, there are two strategies. One is called rate control. Rate control is where you control the heart rate to a normal range where the patient does not have symptoms. The other strategy is called rhythm control, where a physician may use a certain medication or may use an electric shock to shock the heart back into a normal rhythm.
Dr. Divakaran has one important reminder.
So it's important to remember that atrial fibrillation does not shorten your lifespan. People live normal, fulfilled lives in atrial fibrillation. This is not an issue. The most important thing is to prevent the complications of atrial fibrillation, such as a stroke, or sometimes to make sure that the heart doesn't go too fast or too slow.
If you or someone you know has atrial fibrillation, make sure they are continuing treatment. That is the only way to lower the risk of complications like stroke. And if you have any symptoms, seek treatment early. Atrial fibrillation is something that can be lived with but must be managed. Speak to your doctor for more information and to know what treatment options are best for you. For RxWiki, I'm Gabe Garza.